Now, the publication of the so-called Green List is to be delayed after today's Cabinet meeting to consider the issue was postponed. The Cabinet had been due to meet today to sign off on the countries to be included on the list, but is now set to take place tomorrow after Taoiseach Micheál Martin's return from the EU summit talks in Brussels was delayed. The list will mean that people who have to travel to approved countries for essential reasons will not be required to self-isolate for 14 days when they return to Ireland. Official advice will be to continue to avoid all non-essential overseas travel. So, should we even publish a green list? Well, to discuss this, I'm joined on the line now by Eoghan Corry, editor of Air and Travel magazine, Dr. Jack Lambert, Professor of Infectious Diseases at the Mater Hospital and UCD, and Dr. Maitiu O Tuathail, who is a GP based in Ranelagh in South Dublin. And thank you all very much for joining me this morning. Jack, I might start with yourself. A lot of confusion around the green list and what it means and what it doesn't mean. Is it wise, do you think, from a public health perspective, to publish it at all?
Well, actually, I think we do need to publish a green list. I mean, there is we pretend that we're an island, but we're actually part of the European Union, where we have a shared border with the UK. There already are green lists within the European Union and within the UK, and people are coming into Ireland, whether we like it or not, foreigners and Irish people returning. So I think moving forward, yes, we actually need to have a plan, because COVID is not a short-term problem. It's going to be a long-term problem. We need to come up with long-term solutions.
Okay, so what would you like the green list to do then? Well, what I mean by that is initially when this was talked about, the sense that we were getting from government was that these will be countries that we would be safe to travel to if we wanted to, perhaps even for a holiday. But now the advice seems to be these are countries that if you have to travel to, you don't have to quarantine on return. Do you think the initial plan would have been better?
Well, look, I'm not here to. This is just my personal opinion. Is we are going to continue. I think the expert opinion is that this is going to continue for years and years and years. We need to have a long-term plan, and of course, don't travel unnecessarily. But people are traveling, and there's lots of reasons to travel, personal reasons, family reasons, and there's actually lots of reasons for us to have to think economically that we need to look at our travel industry and restarting that in a safe way. So yes, I do think we need to. I don't have all the solutions here, but yes, we do need to come up with a green zone and a red zone of risk, high risk, low risk, no risk of people coming back and forth into Ireland. We are not an island. We are not New Zealand. In the same sense that New Zealand is. So we can't use that comparison. We need to come up with a proactive plan for Ireland that makes sense from a safety standpoint, from a psychological standpoint, and from an economic standpoint for the Irish population.
And when you say years and years and years, you think we'll be living with the virus for that long?
Well, I think it looks like that's what's going to happen. We're now 5 months into this, or if not longer. This started in December. That's why it's called COVID, 19. It was 2019. We're now in July. And if you listen to the discussions that are going on in WHO, the goal is not to eliminate COVID. The goal is to manage it. And how long will we have to manage it? There was just an expert opinion this weekend talking about that this might be a 3-year thing. So yes, we do need to move forward in a safe way, cautiously, but come up with a detailed plan. To say that eliminate everything is really a blunt instrument. We really need sharp, precise details about what our proactive plan will be moving forward in the short term and the long term.
All right, stay with us, Jack, if you don't mind. As I said, we're also joined by Maitiu O Tuathail on the line, who is a GP in Ranelagh in Dublin, and thank you for joining us, Maitiu. You were tweeting over the weekend that the publication of the Green List will cause more confusion. How so?
Yeah, well, I mean, if you look at the situation at the moment, it's just hugely confusing. So we're being told there'll be a list published of countries that are safe to travel to that you don't have to quarantine if you come home. But then we're being told in the same sentence that you shouldn't travel there unless it's absolutely essential. And then we're being bombarded with ads, for example, by Ryanair telling us that you can travel to over 1,000 destinations. So what I'm seeing in my surgery is people that are completely confused. I'm confused. It's a completely mixed message, and I think it's just completely wrong. I think it needs to be simplified. I think we need to say, number one, basically there should be no non-essential travel. I think we need to define what essential travel is, and I think there should be a mandatory quarantine for 2 weeks and people come home. That's a very simple message. But I think at the moment people are really, really confused, and I don't blame them, because it's just very difficult to get your head around what's happening at the moment.
And what do you think non-essential travel should be?
So non-essential travel in my opinion is basically a holiday which people shouldn't take and shouldn't undertake at the moment. I think for many reasons, including economically, people should stay at home. In terms of what essential travel is, I think there are two reasons in my head, and this is just my own personal opinion, something critically important from a business perspective and a personal reason. So for example, if you have a sick relative abroad, I think that is a reason that you can travel, but again that you should come home and mandatorily quarantine for 2 weeks. The reality is if you have a sick relative in the States at the moment, you are going to visit them because that's what we're going to do. So whether they're on the green list or not, if you have a sick relative that you're worried about, you probably are going to travel. So the single most important thing, and the message needs to be that you need to mandatory quarantine for 2 weeks when you come home.
But what do you make, though, Maitiu, of what Jack is saying there, that it looks like we're going to be living with this virus potentially for years and years? And if we just take the example of Britain, people living there, lots and lots of people living there, working there, Irish people who would like to come home and visit their family. It might not be practical for them to do that if they have to quarantine for 2 weeks and then see their family from a work perspective. It won't be practical for a lot of people. So can we just keep saying to them, stay there for years, potentially?
Yeah, well, look, that's a very, very difficult situation. I think this is the new norm. I suppose I'm not a particular expert in this field, but what I do is look towards those that are. And NPHET have been advising that we do this for the last 3 months. I think it's concerning that the government have decided to ignore that. But what I would say is that NPHET have steered us through this as a country incredibly well. I mean, this could have gone really, really badly. We've come out of this largely unscathed. And if the NPHET and the Public Health Advice and the Infectious Diseases Society of Ireland are advising us that this is what we should be doing, then I'll be following their advice, because I think that's what we need to do at the moment. Things may change going forward. I mean, I think today we learned that the level of immunity within the country, or herd immunity to COVID, is very, very low. So at the moment, I think we're still in a precarious position, and I really think that we need to protect ourselves first and foremost.
What do you think of that, Jack? NPHET are advising and have been advising for months now, mandatory quarantine. Never mind come from a green list and do whatever you want.
So I'm not disagreeing with Maitiu, and I'm not disagreeing with NPHET. I think we need to put together plans that have clear messages. I think we need to put together plans to protect our ports. Currently, the situation is people show up at the airport on their way into Ireland and are given a piece of paper, and most of them are not being called, and I don't know if they're isolating or not. We need to have a plan moving forward, and this should have been thought about 4-8 weeks ago, and I think it hasn't been. And, I think moving forward, we need to have a very robust, proactive plan that takes into consideration safety and all the other considerations. So I think we're all saying the same thing.
Okay, so what do you think the plan should look like then when it comes to international travel? What should it look like?
Well, I'm not an expert. I'm not an expert. The current plan is like I said, is lots of mixed messages, lots of communication, lots of advertisements. I think the plan should be we should all get together and have a discussion with all stakeholders. So all TDs, all ministers should get together with affected groups. There's outbreaks in Ireland. There's outbreaks in countries throughout the world. At the present situation, only 12% of COVID cases are coming into the country. 88% are Irish-bred cases. So we actually need to put together a plan that comprehensively minimizes COVID in Ireland, and travel is part of that. And I agree, non-essential travel, but it's defining non-essential travel, but people are traveling, and we need to have a short-term and a long-term plan. Wait and see is not a plan. Listen to NPHET, alone is not a plan. We have lots of leaders, ministers, TDs. We've got private industry, who all, I think, should be part of the discussion and part of the solution at this stage moving forward.
All right. Well, as I said, we also have Eoghan Corry, who is editor of Air and Travel magazine, on the line. And Eoghan, thank you for your patience staying on the line there. We've lots of texts and emails in on this, and I might just put one of them to you, Eoghan. This person says, I was in a hairdresser's in County Monaghan on Saturday. The hairdresser told me I was the only client she had that day who was not going abroad on holidays. She said 2 customers told her they were going to their apartments in Spain, which would be very safe because they would be avoiding hotels and would only be popping out to eat and for a few drinks. I nearly fell off the chair, says that listener. Would that surprise you? And do you think that person is right to nearly fall off the chair? Is that something to be shocked about?
Spain is safe. The reality is that the rest of Europe has moved on this. All these arguments that we're still having were had at the end of May. On May 27th, Margarita Schinas came up with the EU Commission plan to reopen borders. June the 15th, most of them reopened, and we're still talking about a green list a month later. The reason we're doing so is that there doesn't seem to be, with the change of government, there wasn't anyone to make that decision. And into the vacuum, we had a lot of personal opinions, people coming out very strongly against travel. Dr. Jack's figures there, about 12% imported cases in the last few weeks. If you look back to the start of the crisis, travel was 1.6% of total cases. It's something that people have become fixated on. It's something that people have become fixated about because that's a natural sort of thing all the way back to the Black Death. If there's a plague out there, you try and stop it reaching us. It's also directed by the sort of narrative we've heard over the weekend. But it's quite clear that what we're coming up with today is not even the start of a plan, never mind a plan to manage, look forward, go on, follow the rest of Europe and live alongside this virus.
But can I ask you, how can you say that Spain is safe? Because we know that some parts of Barcelona have just gone into stronger restrictions.
The reason I say it's safe is that the European Union has drawn up its sort of guidelines. It didn't just think them up. The EASA, the European Air Safety Authority, with the European CDC, sat down and published their guidelines on June the 12th. They're supposed to be implemented by the national bodies. It still hasn't been implemented in Ireland. Everybody is following the same sort of sets of data. The pattern is quite clear, and all the medics are agreed on this, that the outbreaks tend to be in the less fashionable suburbs of large cities. The touristy regions don't tend to be where the outbreaks are. For instance, Spain will probably not make the list today, but if the Canaries were regarded as a separate entity, which they are in duty-free and many other terms, it would be the third best in Europe. It would be certainly be best in class behind Malta and Finland. The way the outbreaks, and there have been nearly 20 new outbreaks since the borders opened on June the 15th, they haven't been related to the reopening of borders. They have been related to, as I say, the unfashionable suburb. Even Lisbon, the 19 parishes of Lisbon where the outbreak came are not the place tourists go. Travel is careful. Every European country is really, really jumpy about this. They don't want to re-import cases. We're not the only ones who've made sacrifices, but there seems to be an understanding across Europe, Sarah, that we don't have here, and we're a very connected island. We were at the beginning of March a very connected island, that life has to go on, and that if travel is not a major contributor to the problem, you would think it's a major contributor from the narrative in Ireland, but that hasn't been the international experience.
All right, I want to put some of that to Maitiu O Tuathail. What do you make of that, Maitiu? That Spain is safe, according to Eoghan Corry, or at least certainly the tourist areas that Irish people will be travelling to are safe, and that everybody is doing their best. It's not like you're going to a country where nobody is taking any precautions over social distancing or hygiene or any of that.
The problem is the unpredictability, which you highlighted. So, 3 weeks ago, Barcelona was deemed safe. Now they're going to restrictions. And the way that I see this panning out, as Dr. Professor Lambert had said, would be there'll be peaks and troughs all over Europe and probably in Ireland as well. So it's very, very difficult to predict today where we'll be safe to travel to in 2 weeks, let alone 4 weeks. So the safest thing to do at the moment, is, as I said, to stay home. Ireland is in a unique position, which is why it isn't fair to compare us to Europe, in that we are an island. We can control our borders, and if we were to introduce mandatory
we can control some of our borders. There's a big border with Northern Ireland that we can't control.
Well, that's a political piece that I think we'll be hopeful that we could sort out. But if you look at the moment in New Zealand, there are 25...
Would you though, Maitiu? Because that's what this all hinges on, isn't it? Really, and it's not an insignificant political piece. There's lots of issues there, and there's no sign at all that would suggest that there would be cooperation between North and South in relation to the control of the borders.
No, but if you look at New Zealand, which is a similar island-based country, they have 25 cases of COVID-19 and they're all in mandatory quarantine at the moment. And I think that would be where we should be aiming to look for. In New Zealand at the moment, there's no need to wear face coverings. Everything is as per normal. There's no need to do social distancing because there's just no COVID-19 in the island. And I would love for this country to aim and to get to that stage. And as I said, because we're an island, it is realistic to do that. But as I said, at the moment, the level of unpredictability is just too big. So if anyone asks me for my opinion, I would say, as I said, NPHET have done a great job in guiding us in terms of where we are at the moment. I just think we need to follow their advice. That may change going forward, but at the moment the level of unpredictability and the risk is just too great.
In terms of the confusion and general sense of confusion, Jack, around this, a couple of texts in relation to that. A person says, I'm not confused. It's no to non-essential travel, no to holidays, quarantine if you travel to non-green list countries. Another person says it's impossible to be absolutely clear-cut. Everyone is trying to find someone to blame. Common sense should prevail. Only go if necessary. Would you go to a malaria or fever zone without taking precautions? We don't have a vaccine. And maybe that's a little bit of what's lacking in this discussion. Is it just that people need to use their common sense?
Absolutely. I think there has to be a huge amount of common sense, and that's common sense within Ireland. And some people are not practicing, good practices. And I think it's common sense if you travel. And like I said, I think that really is an important part of it. We can't mandate, we can't legislate good behavior. We have to educate people on it. And that's people who choose to travel, and they are traveling. And I'm not traveling. I've chosen not to. But it's also responsibility of youth, and people who are going to parties, that we have to educate them on the dangers of and the consequences of missed cases and spread of COVID again. We want to prevent that at all levels.
Okay. Can I ask you, Eoghan, about the issue of travel then? Because we're being told that even if people go to green list countries, that they won't be covered by their insurance. And we've a text in here from Trish. She's saying, what about families who have children and grandchildren that they haven't seen since Christmas who live in the UK? Can they travel to see their family, or is that non-essential and therefore no insurance is valid? So it's a very valid question, isn't it? When does an insurance company judge something to be essential or non-essential travel?
Right, and that's going to.
Sorry, Jack, I'm going to own on that.
It used to be very clear-cut. There are 4 levels. Number 3 is non-essential. Number 4 is don't go. The whole world is on number 3. Some of the narrative we've heard, or the leaks we've heard over the weekend, is there's pressure not to change that, even for the green list countries. I would expect that level to go down to level 2, which means it would be covered by travel insurance. The reality is that the decision on what is essential and what isn't doesn't actually arise when you're taking out your policy or when you're travelling. It arises when it claim. And as you know, insurance companies are all over the place. They're handling all of this on a case-by-case basis. They're confused because large numbers of people are travelling, 82 flights out of Dublin Airport today, for example, and the people who are doing so are going to be bringing back claims, and the insurance companies don't have the directive from national level from the government. It's time for the government to sit down at the cabinet meeting and decide what's non-essential, what countries need to be on level 3, what countries need to be on level 2. I think the problem is not really that we're all sitting here saying on the one hand this and the one hand the other. The fact is the government has never sat down and defined where we were allowed to travel to, and about €1 million of bookings of people that have paid for their holidays are being lost every day by consumers with no chance of a refund because they can't show up at the airport and go against public policy. Those that are going ahead with their holidays.
And Jack, you wanted to get in on that?
No, I just think this isn't. We've made lots of mistakes. No blame game. Why don't we just get all of the appropriate people in a room together rather than us being sitting waiting? There's going to be an announcement in 2 weeks as to next steps. Okay. I think we all need to be part of the solution here. We need to use the convention centre, get the appropriate TDs and ministers and private industry together and come up with solutions that make sense. We all have something to contribute to coming up with solutions and preventing further spread. All
right, Maitiu, just very briefly, if you don't mind, I know that you were working at a COVID assessment hub last week. What did you see on the ground? Did you see any spike in cases?
Well, as a GP, I suppose we're seeing a slow but steady increase in the number of people contacting us with COVID-19-like symptoms. Now, it's not alarming, but maybe 3 or 4 weeks ago, we could have several days where we had no one contacting us. So we are seeing a slow but steady increase in the number of people with COVID-19-like symptoms contacting us. I had 2 patients who had presented to us with COVID-19, which is associated with travel abroad. So I'm seeing that in my own personal experience. But the numbers are small. But again, I think the message needs to be simplified. Very, very simple. Don't travel. But if you do travel, you need to quarantine for 2 weeks and coming home.
All right. Well, thank you all very much for joining me this morning. That's Maitiu O Tuathail, Jack Lambert and Eoghan Corry. We'll be back after this.